better place if all medications didn't have any side effects. Unfortunately, that's not the case, and bodybuilders have to deal with tons of side effects during their bulking or cutting journey. Some adverse effects are mild and others are moderate or severe. Clenbuterol has been a great deal in the bodybuilding field. Its cutting benefits are irreplaceable. Many users of Clen focus on the benefits and less on the side effects. However, I'm here to address what to expect from clenbuterol in terms of adverse effects and how to overcome it. This drug has been classified as performance booster drug and not a steroid. The whole point of this drug was to get rid of asthma and cure asthma patients. Unexpectedly, some of the asthma patients lost weight while using this drug, and was found out accidentally that Clen is also good for weight loss. Clenbuterol ended up being the best drug to be used for fat loss. It's the bodybuilder's favorite before summertime to show off the six-pack. Why clenbuterol became so popular? The bodybuilding industry started to shake once there was a leak on celeb news that some celebs were using this, including Lindsay Lohan, Britney Spears and Victoria Beckham. Twitter was on a fire about #Clen and #Clenbuterol. People started to use it and report more than 50 pounds of weight loss in 26 weeks, which is ridiculous amounts. Many have reported losing 3 to 5 pounds per week. However, the issue didn't remain great after many encountered the clenbuterol side effects. Clenbuterol has many brands, every brand has its side effects. Marketed as Minors, Ventopulmin, Dilaterol and Spiropent is a sympathomimetic amine, used by sufferers of breathing disorders as a decongestant and bronchodilator. What these brands had in common was the 6 harsh side effects. 1. Shaky hands, tremors. Shaky hands is the first adverse effect after taking Clen first few days. Many reported it goes away after a week or so. However, this varies between individuals. The best way to overcome this is to not go with the normal dosage straight away. Start with half the dose. If all is good, then proceed to the full amount. 2. Muscle cramps. This is also a very common negative effect. The best solution to overcome this, taurine, extra water, and potassium supplementation should stop the cramps. This very common side effect is caused by lack of taurine. Clenbuterol drains taurine in the muscle tissue. 3. Feeling lightheaded and headaches. Some reported feeling very clouded and intense headache. Best way to overcome this is, with ibuprofen, take it whenever you experience this symptom. Usually, this happens because Clen lifts blood pressure and thus headache takes place. Once the body adapts to this drug, it gets back to normal. Clenbuterol can be extremely dangerous for people with high blood pressure. So if you are not sure that you have this condition, it's better to test yourself first before opting with Clen. 4. Sweating. Due to the thermogenic impact of Clen, meaning raising your body's internal temperature, once this takes place, you sweat. However, it can vary from person to another. Some individuals overreact to this and sweat incredible amount, and some just a few. 5. Insomnia. Clen is a powerful stimulant and its progressive effect can lead to many users not to sleep well. However, it's a matter of time once the body gets back to normal. The best way to overcome this. Ketotifen is what most people take to help them sleep while running Clen. It helps regulate your beta-2 receptors as well and can actually be used so you can run your Clen for longer than 2 weeks. 6. Arrhythmia. Clen is a beta-2 agonist. The beta-2 receptors are mainly in your bronchial tree, but it can also bind to beta-1 receptors on your heart, causing it to speed up. The best way to overcome this. 3 to 5 grams of taurine, potassium, magnesium, min 2 grams alcar, L-carnitine, cardioprotective. There has been rumors that clenbuterol causes hair loss, deepening of voice in women, male pattern baldness in men and gyno in men. That's not true and not even close to any kind of side effects from Clen. Clenbuterol mechanism of action. This drug mechanism can be summarized in 3 points. increases oxygen flow, boosts aerobic capacity and enhances the metabolic rate.